Hi, my name is Emma Holly. I'm a clinical scar specialist and educator. I founded Restore Therapy Training back in 2017, and since then I've trained thousands of therapists with my in-person classes and even more with my online advanced theory course, Understanding Scars. It's a great tool for you to really equip yourself to be able to understand how to work with scars. Check out the text below this video and you can get a discount code. But this video is all about how to work after hip joint replacement. So if you've got somebody who's had a joint replacement, what could be the benefit of using the Lymphatouch device, which is a negative pressure machine, MPT, vacuum massage, or vacuum therapy device? There's lots of good clinical evidence to support how vacuum treatment or vacuum massage or MPT can be really helpful with scars and healing. Let's have a look at how we might use it in our clinical setting. Considerations for treatment, how to apply it, and the benefits that you can expect to see. So my client here has had some scar therapy already, starting earlier on in her journey, once the scar was all knitted together, around about 8 weeks, when her surgeon was happy for us to commence, and we've been having a few sessions, and now we're at 4.5 months. Scar's doing really, really well, although this individual does have a tendency to develop some hypertrophy. So even though we got started on a program with some silicone and some scar care really early on, we have still got a little bit of raised, thick scar in this more distal end. Up at the proximal side, it's actually really nice and smooth and flat. Coloration, we've got a little bit of extra vascularity through the bottom end of the scar here, and we always had a little point where we think, maybe there was some different ways of sort of the stitch was tied off up at this top end, which has got a little bit more kind of like granular tissue in under there. Movement wise, the tissue's all feeling really great. So the considerations, if you've got somebody who's got a tendency to develop these hypertrophic scars, so that's a scar that's a little bit thicker than normal, more vascular and raised above the standard level of the skin, which can go on to really become very, very raised, is to think that the driver for that is that they've got a lot of extra vascularity within them. So we've got to be careful not to overtreat or overstimulate. So with your pressure, whether it's with manual delivery of techniques or with a device like the Lymfatouch, is to be sure that you're not overstimulating with too high a pressure. Better to be more conservative and not drive inflammation, which could actually end up making her scar worse. Secondly is to think about skin tension. So if you come on with a device which is going to create a suction effect, that puts a lot of pressure on those two sides of the scar as it lifts up, if you've got a lot of skin tension in the surrounding tissue. So your approach should be, when you look at all of the evidence, it's evidence-informed techniques that I teach at Restore Therapy, is the idea that actually what we need to make sure is that we've got good skin mobility around the scar, so that when we go to lift up this section, it's not being dragged by excessively tense skin in the surrounding area. So this is particularly important if you've got somebody who's still got some edema around their scar. They may have a lot of tension because they've got a lot of swelling, or if they've been very static because they have been frightened to do movement. So for those individuals, before you come directly on the scar, you need to think about releasing off the skin tension around the scar, so by the time you do the lift, you're not overstressing the tissues where the scar is themselves. So just get my Lymphatouch device warmed up. What I've done already is some manual techniques to ease off some tension around the scar here. So we've done some specialised massage, some sort of tensional release movements to the skin and the fascia to make sure that actually this scar is not looking too stuck. We've done some nice little stretch movements through there. If you want to find out more, do visit my training program. And here we are, just getting the Lymphatouch device on. So the way that this works is you've got an interactive screen here to set the machine as you want, and then you've got different size cup heads. What you need to think about is a bigger cup head is obviously going to take more tissue, but actually is going to be more dispersed, so it can feel more comfortable if you set the machine, it's measured in milligrams of mercury. So if you set the machine to, let's say, 60 mmHg and use this, that'll provide a really gentle dispersion around the area. On the same setting, if you move down to a much smaller cup, you'll be getting more lift and it may feel more intense for your client. So thinking about perhaps starting off with a larger cup to ease off the tension around the area before coming directly on the scar with a more small cup, or with either the medium size or the smallest size head. All of the cups have a little space for you to use a little filter. Obviously, as you've got that air drawing up through the cup, if you've got any dead skin cells that can get pulled into the machine, which we don't want. So we want to make sure we catch all of those. I've put a little bit of the lovely Songbird massage wax onto my client here. So we've got a nice little bit of glide on the surface there, so it's not totally dry. This just then clicks into place. I can then press start, move through the screen, and as I said, I'm going to start at 80. And so I'm going to let her know how it feels. And again, I don't want dragging on the scar at this stage. So I don't want, as I pull in here, if I didn't put anything, have a look at that scar, you'll see that it pulls on the scar moves a little bit. So just while I warm up the tissue, what I'm going to do is I'm going to protect the scar. So I'm going to lay my hands over the scar while I release off outside. My client's not had the Lymphatouch device before. We've been doing some amazing recordings for some other training I've been doing, so she's not yet experienced this. How does that feel?
That feels good.
Yeah, nice sensation. So what's happening is we've got some pulling up of the skin into the cup. So I placed it statically. Have a little look at the colour. What you should see is the negative pressure is really good for bringing the circulation into the area. So you get on lighter skin people, you're going to get that erythema response, and then you're looking for that to return back to their normal skin colour quite quickly. So we get a pinkening, and then quite quickly it's going back to her normal skin colour. So I'm just putting a little bit of pressure down on the scar here, just so that we don't pull on that. We're trying to release off the tension around the scar. So I'm just going to work in some different places, and I'm noticing if any of the areas go perhaps a little bit darker red, if we've got a more stronger response for the blood not being able to clear away from the tissues, which might indicate that it's a little bit more congested in that area, and it might be struggling with the drainage, with the way that the tissues are kind of like recovering after the blood's been taken into that area. Where you have sports people, you might have seen with those marks from cups left on them, that is more traditional cupping, which derived from Chinese medicine, where a cup is left placed static on the skin, and lots of sports therapists are now using cupping within their therapy setting, and I certainly think it's something that's really good. But scar tissue, particularly in that first 12 months, should not be considered that it can be treated in the same way as pre-injury tissue. We need to be considerate of that scar, of the tissue, and the fact that it's got a change of vascularity on and around the scar as a response of the wound healing process that we have to respect. And if we're bringing on a device which is really going to change the vascular response of the tissues in the area, which is what negative pressure NPT, negative pressure therapy, is designed to do, we need to use it with caution. So just going to come back. When we were doing our manual assessment, we had a lot more tightness on this side. I'm just going to come back through here before I go anywhere near the scar. I can then do a little bit of a slide as I've got some oil on there, so she's getting a little bit of a glide. So you don't have to come completely off. Lovely. And now I'm going to come along through the scar now, just checking in. So have a look at your client's face when you do this. Particularly in Britain, we don't always comment if something's uncomfy, so we might see a little twitch around the eyes or something like that. So again, coming with that nice big cup, having a look at the tissue response, seeing how that is. Any prickly feelings, any uncomfy sensation? How would you describe the sensation?
It's pulley. It's sort of
like a stretch?
Yeah.
And we have done some manual cupping, so how does this feel compared to the manual cupping?
It's a little bit stronger.
Okay.
Because I think because you're lifting a bigger amount of flesh, I guess, because it's a bigger area.
So we were using the small silicone facial cups before. So I'd say definitely come sort of back through, do sort of like a run through an area a few times. With these cups, which are more oval in shape, I would say you can vary your position, so you're going to put slightly different tensions through depending on your angle. So this might feel a little bit more
different, yeah.
More comfortable this direction?
It feels a little bit stronger, but not uncomfortable at all.
Okay. And, you know, with this device, the great thing would be that if you work through a treatment program, you could be able to really clearly report what settings you used, how long you used it for, and, you know, if you often draw a little annotation of the scar, you can talk about areas and what the response was like. So you may notice with Belinda's scar that where we were on the scar tissue, we get a little bit longer, that the area stays that darker coloured red compared to the return to normal colour in her completely healthy skin once we're off the scar, which will just really instantly go back. So it's just sort of showing that it could do with a little bit more treatment there. Just have a quick little feel of how that's feeling to me.
Yeah, it's so different, doesn't it? It feels even, whereas before it was quite different from one end to the other. Now it feels really smooth all the way around. Wow.
So just changing to that sort of medium-sized head. I must say this is this head size I use a lot in my clinic. We noticed that we had a little bit more sharpness kind of at the ends of the scar, so I'm just going to start again to the side of the scar for her to get used to the sensation. Mm-hmm. And then I'm going to come through the middle section here, which was least sensitive earlier in the treatment.
That I can feel that. It's nice though.
It's nice,
yeah.
Okay. And obviously, again, that idea that we can change the direction, it might feel more intense.
Yeah, it does.
But okay.
Yeah, it's okay though.
And then I'm going to see how that feels taking it. And with any placement of the cup, I always hold it there for a little while. And for me, the idea with that negative pressure therapy is, first of all, we know that it's getting a vascular response. There's some studies which you can reference and have a look at, and negative pressure therapy has been used within scarring for many years. There was actually a French engineer who was in a car accident in the 1970s, and he was having a lot of manual scar massage where they were doing like a manual skin roll. And so what he did, because he was having these every day for many months, he decided that it would be a lot more effective to develop a machine with his engineering background. And he was one of the first people who developed a machine specifically for the use of treating scar tissue. Those kind of machines using suction as part of the way that they work does continue still today within many hospital units where they've got devices which utilise negative pressure, and we're even looking at now some hospitals using negative pressure during wound healing as well, because of changing that force on the scar to encourage healing. So we know negative pressure is really good to activate remodelling and healing of the tissues. But the other thing it's doing, as well as creating that vascular response, is helping to increase the space in the interstitial area, so kind of between the tissues and through that superficial fascia. So it should feel an area is kind of looser afterwards, and that you can feel that it kind of like lifts up more easily once you've worked across an area a few times. So you should get that improved slide and glide if you're trying to just get the tissue to roll around. Certainly when you're treating somebody after a surgery, I always remind people that the scar is just the tip of the iceberg, so do work around the scar as well and think about where the deeper trauma has been, as well as that more superficial trauma. And you know, I'm recording a video here, so I'm kind of like keeping the heads on for a little bit less time and a little bit less concentrated on what I'm looking at in the tissues. But I'd very much be having two hands on and feeling the tissue response, feeling the tensional pull between the hand that's stabilising and the one that's holding the device. And just so that we can experience that smaller cup, we'll try that. So this then a much smaller cup. Again, this has all been with the same setting. How does that feel? More intense, less intense?
Probably it doesn't. Feels alright. It doesn't feel as intense as I thought it would.
Okay.
No, it doesn't. Yeah, it doesn't feel. It feels less intense. I think it's more targeted. It feels more targeted.
Yeah.
So if there's a little area there that is going to respond, it responds a bit more.
Now, if you're working on somebody, Belinda hasn't got any persisting edema and certainly hasn't got any lymphedema. If you're working on somebody whose scar is in an area where they've got still lots of edema, possibly even some lymphedema as a result of their surgery, the thing that you need to be really aware of is the fact that this is actually really going to pull fluids into that area. And if they're not draining very well, you could end up pooling fluids in the wrong place. So you need to think about whether or not, if you've got a client, particularly if they've got lymphedema, what you're going to do to support the lymphatic drainage after a treatment. because certainly you would want to open up the lymphatic pathways prior to using your negative pressure treatment, then deliver your negative pressure treatment, and then do a clear out afterwards, so that you're supporting that lymphatic drainage, having really stimulated an area, so that you're not going to end up with loads of waste products and that protein rich fluid sitting around and solidifying, which can then become more fibrosed, which is not what we want around a scar. Certainly in terms of treatment duration, if I'm using the Lymphatouch, it's really nice to do continuous use for between sort of 7 to 15 minutes as a minimum, but you can go on and spend longer to do it, and depending on what kind of program you're working towards and what you're hoping to achieve. As well as doing these kind of pulses, which I really like, you could go on and do some gliding pressure. So in order to do that, we change from, do you want support under there?
No, it's all right.
Which I'm just changing now onto a continuous. Gonna just let her feel what that feels like, so a little bit stronger. Is that okay?
Yeah, it feels
I'm gonna
fine.
put that on the scar. Just
that
work
feels
down.
quite nice, actually.
And then gonna stick on and slide down this way. Stay on, go backwards. Stay on, go backwards. Gonna go back and forth a few times. Could go more slowly, might feel a bit more intense. Could go in the other direction. Now you've also got the option of adding in a little bit of vibration. It makes a bit more noise. The vibration I think can be really, really helpful. So I've put 60 hertz of vibration, so we're going to get a little bit of vibration through the cup while I'm doing that continuous. So when you're ready, that can really help to kind of move more easily through the tissues. I think that vibration just stops kind of like sticking and gripping. Also, if you've got a client who's got kind of sensitivity, pain around the area, I think that vibration can give them an extra neural distraction, which can be really helpful for those techniques as well. So all the time just stabilising and working away from a stabilising point. The difference being if I was just on this scar and dragging it around.
No, that's not fun.
That's not nice. So always work with that stabilisation of the tissues. It is, you know, a bit of a strong pressure there, and it doesn't feel nice to have that pulled around. And again, if you're in early healing, you could actually be protecting the scar and working around the area. And I think that vibration is also really nice for the sensation and the direct drainage in early healing. Just turn that off for a second. Particularly with somebody who's had hip issues, what's really nice is when you finish working the scar is to do a little bit of massage with your Lymphatouch. So I'm just going to do that to finish off my treatment with my client here. So before you start using the Lymphatouch to do a back massage, we need to get some medium on the area. My client's particularly pointed out she wants me to work specifically her lower back. Obviously, normally I would have the whole of the back exposed, but for the sake of this video, I'm just going to show how nice it can be to work around this area. So I'm just spreading the oil around this area. And also, if that thought of working the scar in different areas as well. In order to do the back massage, you're going to want to put the machine working on a continuous. Once you go on to continuous, you want to be on to a lower setting than you would be for a static. I'm going to start off with that second from largest cup size. Again, that idea, create a little bit of a stabilising hand, add on, and then just check in with that pressure. Is that okay?
Yes, absolutely.
Okay, really nice. And then we're going to use both hands, but the one that's, oh, I'm sorry, I've got the vibration on there. There we go. So we're going to work with both hands together, although it's the machine that's doing most of the work. So I think with somebody like this who's more petite, they're going to benefit better from the smaller cup head size, and possibly, I think, knowing my client, she's going to want me to turn up the pressure a little bit. Certainly with the smaller cup head, once you're doing that nice sort of more massage, getting it up a little bit higher is going to feel pretty good. So I'm now going up to 165. I've got that smaller rounded head on, making sure I'm really holding onto the head as well as the top of the machine, and then coming on there. How's that pressure for you?
That feels great.
Really nice, isn't it? And that idea that, you know, if we had any kind of like real compression in through the tissues here, we're really working in and around, and we can do some really nice work on around. that lower back, which should feel pretty good. And just going nice and slow feels great. Following those contours around. And then going up the side of the spine. And across. If you've got somebody who's really tight in their back, I'd probably come through on the bigger head on a pulse setting first. That's really going to kind of help with that sticky, dry fascia tissue that you can get. Once you've loosened off with that pulse setting, you can then go on to the continuous, and it will feel easier for you and the client. And the pulse setting does still feel nice in the back. It's not only appropriate for scars. So if I put that on here so that my client can feel it, I'll probably turn it up the pressure a bit. How does that feel here?
That feels good.
Yeah, so I'm up then at 230. So using those higher settings in healthy tissue, see you've got a nice strong erythema response here. And again, you know, thinking about whether or not it's appropriate to do a really strong suction on the scar. The stronger suction in some of the papers has been shown to work actually less effectively on some of that thickened superficial scar tissue, because it's actually progressing more and stimulating the deeper tissue. So always think about where is it you're hoping to work, and that pulse setting coming up the spine can feel really nice as well, just to work through and create some more stimulation, warming up the areas as you work on the back as well. So there's lots of techniques that you can do with your Lymphatouch. It's a really great device that can be used in many diverse situations and feel great for your clients. Hope that was a useful little video.
It was for me. That was wonderful.
Oh. So I hope you found that video useful, and don't forget I've got other videos on my channel showing you how to use different devices and tools in order to work with scars to get the best results with your clients. And if you're looking for a top-class education provider, get in touch, go to restoretherapy.co.uk and check out the online and blended online and in-person courses that we offer around the world.